We want to go right to D.C. right now to the Rose Garden where the president just started speaking.
That's right. Let's take it from here.
Of the millions more who've gained access through Medicaid expansion and the Children's Health Insurance Program. Making affordable coverage available to all Americans, including those with pre-existing conditions, is now an important goal of this law. And in these first 6 months, we've taken a big step forward. And just as importantly, this law is bringing greater security to Americans who already have coverage. Because of the Affordable Care Act, 100 million Americans have gained free preventive care like mammograms and contraceptive care under their existing plans. Because of this law, nearly 8 million seniors have saved almost $10 billion on their medicine because we've closed a gaping hole in Medicare's prescription drug plan. We're closing the donut hole. And because of this law, a whole lot of families won't be driven into bankruptcy by a serious illness because the Affordable Care Act prevents your insurer from placing dollar limits on the coverage they provide. These are all benefits that have been taking place for a whole lot of families out there, many who don't realize that they've received these benefits. But the bottom line is this: under this law, the share of Americans with insurance is up and the growth of healthcare costs is down. And that's good for our middle class, and that's good for our fiscal future. Now, that doesn't mean that all the problems in healthcare have been solved forever. Premiums are still rising for families who have insurance, whether you get it through your employer or you buy it on your own. That's been true every year for decades. But so far, those premiums have risen more slowly since the Affordable Care Act passed than at any time in the past 50 years. It's also true that despite this law, millions of Americans remain uncovered, in part because governors in some states, for political reasons, have deliberately refused to expand coverage under this law. But we're going to work on them. And we'll work to get more Americans covered with each passing year.
So the president there speaking and really touting some of the benefits of Obamacare, speaking of medical care in terms of mammograms, contraceptive care. We were talking about the premiums. He mentioned that.
Yeah, he said the cost is still rising on those premiums, but he just finished by saying that millions remain uncovered because governors across the country, some governors have refused for political reasons, perhaps to this. Virginia is one of those states that has not expanded Medicaid yet. You just heard from Governor McAuliffe a few minutes ago. McAuliffe wants to expand Medicaid. We're going to have more on that coming up tonight.
You were there today.
Yeah, tonight at 5 o'clock we'll have more on that. But right now there's an estimated 400,000 Virginians who remain uncovered. They're still in that Medicaid gap. So again, we'll have more on that coming up tonight on Wavy News 10 at 5.